Hi, this is Dr. Gary Sykes, and a popular question is it dangerous to have diabetes in pregnancy? Well, I've been managing diabetics, pregnant patients with diabetes for decades, and I've never had any issues. I've never lost a baby, had a stillbirth. I've never had any great dramas at all, really. The key to diabetes management and making it safe for mother and baby is to keep the blood sugars in the normal range. Now, what is necessary to do that is irrelevant. For mild diabetes, it's a change of diet. But for more serious cases, they need to be on insulin. How much insulin is required is irrelevant. Someone will get concerned. Oh, don't take too much. No, it's about keeping the sugars in the normal range. It's not about how much insulin you're taking, it's keeping the sugars in the normal range, and whatever it is whatever it is. Then you get the other women who are diabetic before they get pregnant. And I've had many of them over the years, and I've had them entering the pregnancy on a very significant amount of insulin. They can be a bit of a challenge because they're not they've got a bit more blasé with their diabetes, with a bit of slack with maintaining a good optimal blood sugar level. And it's a case of re-educating them and saying, look, the situation is different now, and for your baby's sake, you've got to keep your sugars at the right level. Certainly I've had women where they've been on so much insulin that they brought their own supply to the hospital because they were worried that the hospital would not have enough insulin for them when they're in labour. By the way, it doesn't necessitate you need to have a caesarean section. No, by no means at all. If you are an insulin-dependent diabetic, then we certainly would be considering you delivering your baby a little bit before your due date, not much. If you don't need insulin, certainly it's a good idea not to go very much overdue. We're very conscious of the baby's growth. Both can happen. You can get the baby growing too big and also too small, but these things are more common in a poorly controlled diabetic. So as long as you maintain that blood sugar in the normal range, then be reassured, relaxed that everything should go well. Requires more hard work, but it's certainly worth it. But also as a note, it's a good idea to learn a lot about food because with the diet changes that are required, they teach you about sugar and all sorts of things like that, because sadly you are predisposed to diabetes in another pregnancy and also later in life, and the best way of minimising that risk is to make sure you have a healthy diet with minimal sugar intake, not only in the pregnancy but once the baby has delivered. I look forward to speaking to you again soon. Bye for now.